Good morning, everyone. It's a bit of an odd experience when I don't see the face of almost anyone apart from the speakers, but it will not prevent me from welcoming you to the plenary of the 5th International Conference on Public Policy. My name is Isabelle Engeli, and I have the great pleasure to chair this roundtable today. This roundtable discusses maybe the reason why we are on a hybrid format for ICPP, which means that we are talking about the lessons of COVID-19 for public policy. The roundtable aims at taking stock of the pandemic to advance our understanding of policy making in times of crisis and potentially in times of non-crisis too. We will see what the speakers have to say. Drawing on the COVID-19 experiences from countries across different regions of the world, our speakers will offer their perspective on the nature of policymaking challenges in time of crisis and the factors that affect policy responses. Indeed, it is time to reflect on those responses. There are already a number of fascinating special issues on COVID published in JEP, Policy in Society, West European Politics, Journal of Comparative Policy Analysis, among other journals. The contribution of this roundtable to this COVID-19 endeavor is to take COVID-19 as a case to reflect on the opportunities, challenges, and limitations about our knowledge and understanding of policy making. The speakers have 4 main questions to address. They may decide to drop a couple of questions. I give them quite a bit of freedom. The first question is, what can we learn from the COVID-19 crisis about public policy? Do we have to revisit our scholarly knowledge to make sense of policy making in times of crisis? Is COVID-19 a crisis among others, or does it have specific characteristics that makes it one crisis of its kind? And last but not least, because I will still be teaching in 20 years, in 20-year time, we will teach public policy to students who will not have experienced COVID-19 themselves. What shall we say about the crisis and about the capacity of the discipline to understand the crisis and its aftermath? We have 5 fantastic speakers. Many thanks to all of them for having accepted our invitation to speak on this roundtable. I'm not going to speak much longer. You are not here to listen to me today, lucky you. I'm only going to take a few more minutes to introduce our speakers, and then I will give them the floor. Our first speaker is Will Jennings. Will is Professor of Political Science and Public Policy at the University of Southampton. His research engages with questions related to public policy and political behavior in relations to agenda setting, public opinion, elections, political geography, policy disasters, and anti-politics. He is the author of The Politics of Competence and The Good Politician, both books published with Cambridge University Press. He is currently the principal investigator of a big research project on trust and trustworthiness in national and global governance. How timely is that? On his spare time, mostly at nights, I suppose, Will is also an election analyst for Sky News, among other activities. Our second speaker is Olivier Borraz. Olivier Borraz is CNRS Research Director and the Director of the Center for Sociology of Organizations at Sciences Po Paris. Olivier has worked extensively on risk governance and risk-based regulation, as well as crisis preparedness and management across a broad range of sectors, including occupation and health, flooding, and food safety. He has recently published with colleagues a great book on COVID-19, Une crise organisationnelle at the Presse de Sciences Po. The book is in French, but I'm hoping that at some point we will have an English translation of this great book. Paola Profeta is our third speaker. Paola is Professor of Public Economics at Bocconi University, Director of the AXA Research Center on Gender Equality, and she's also the President of the European Public Choice Society. Her research focuses on public economics, political economics, and gender economics. Paola has recently published a fantastic book, Gender Equality and Public Policy, Measuring Progress in Europe, also published with Cambridge University Press. Our first speaker is Mireille, Manga, Edimo. Mireille is senior lecturer at the Department of International Politics of the International Relations Institute of Cameroon at the University of Yaounde. Mireille is also a member of the College of IPA. Mireille's research includes policy studies in Africa, migration policies and citizenship, expertise and culture, and higher education in Africa in times of COVID-19 pandemic. And we are still waiting for last speaker, but in case he can join, I will still introduce him. Our last speaker, but not the least, is Jay Moon. Jay is Professor of Public Administration at Yonsei University. He's the Dean of the College of Social Sciences and the Director of the Institute for Future Government. Jay is currently co-chairing the Infectious Disease Study Group of the National Research Council for Economics, Humanities, Social Sciences. Jay has extensively published on digital government, public sector reform, and comparative public administration. He has recently published 2 highly interesting pieces on COVID and policy response in Public Administration Review and Policy and Society. This is it for me. I've spoken more than enough. Time to let our fantastic speakers rock the show. It is thus my great pleasure to turn it over to our first speaker, Will Jennings. Will, the floor is yours.
Okay, thank you. I will just share my screen. Let me know if that's not showing up. So Isabelle, it's a great pleasure to talk to you today. I was just, as you were finishing talking, reflecting on what we might be doing in 20 years and how we'll be thinking about that pandemic. And I suppose my cautionary note would be, I think, in some ways, it's very easy to talk about COVID and the pandemic in terms of, returning to normal and thinking about, kind of just, in 20 years we'll be looking back. But it's actually one of the things from studying public policy over the years is that things can take us by surprise. And we shouldn't think that pandemics will have gone by that stage. I remember about 15 years ago working in the ESC Centre for Risk and Regulation in the London School of Economics, when everyone was anticipating the bird flu pandemic that never came. So I think as societies, we're very quick to forget what we've been faced. Let me just start, if I may, click through the next screen on my slides. Just to give you a sense of where my thinking is before I turn in a little more detail to questions of trust. For me, what's been fascinating as I think many social scientists who have been faced with COVID is that the pandemics created an incredible kind of almost an experiment about how we understand societies and the state. It's provided an incredible stress test for governance systems and the relationship between citizens and the state. And I'll give you a tiny bit of a flavor of the evidence that we have from our project about how the pandemic has allowed us to understand a little bit better that relationship. It's also exposed vulnerabilities of political and administrative capacities and decision making. I won't talk too much about that, but I think it's really important. I was a bit torn, as you know. I work on policy disasters, and one of the aspects of COVID that I've been very interested in is about how decision makers and governments have responded to the crisis, and I think it's provided some really valuable lessons. The crisis has also highlighted tensions over the roles of experts, highlighted problems of misinformation and conspiracy beliefs. And in that sense, the pandemic is just a little bit of a petri dish for all these sorts of problems that contemporary societies face. So I will be a little bit, maybe, I don't know whether I'll be that controversial. So for me, the pandemic hasn't raised new issues about governance and public policy, but they've thrown these problems of 21st century governance into sharp focus. And as I'll say, I think one of the things about trust is that it's really provided insight into how citizens view governments and policymakers in times of crisis. I remember when the pandemic hit, we started on our project thinking about trust, and the literature says that trust is essential in terms of the response to the pandemic, but it would also come under threat to it. And so actually, as we've studied it over the course of the last 18 months, it's become, that's become increasingly evident. So let me just say, what I want to do here really today, I'm going to give you some very quick, I'm always conscious that I will talk for too long and you'll tell me off. So I'll speak to time. I'm going to say just very briefly what I think we've learned about trust. trust and how it matters for governance of COVID-19. And I'll talk broadly around citizens' perception of the threat of the virus, how it's impacted support for political authorities, and also really crucially behavioural responses to public policy. In the UK, as you know, we are just heading towards an easing of restrictions, and actually trust is really important, not just in terms of questions of compliance, but it's also related to vaccine hesitancy, but it's also important for actually citizens taking matters into their own hands. I should say that one of the things about the kind of slight kind of coincidences of the pandemic and so forth was that we were working already on a project on trust and trustworthiness in national and global governance when the pandemic hit, and I suppose you'd say our existing theoretical framework was it was framed in the context of declining trust in governance, how this was impacting countries across the world. And the pandemic has really provided quite a different take. It's really motivated that study. So what we've been doing is we've been conducting surveys cross-nationally, survey experiments, and also qualitative analysis. So we've as the last 18 months have gone on, we've conducted surveys in a number of countries. We're still running surveys in several more countries. We've also run a program of focus groups, initially in the UK, but actually since then in 7 other countries, including the US, Australia, Italy, Croatia, Argentina, Zimbabwe, and the Philippines. I'll predominantly talk about the data from the UK to date, but this program of research has been really fascinating and shed a lot of light on how citizens are relating to the pandemic. So if you excuse me as we go through, I will show you through a few graphs, but I won't dwell on them in too great detail, just to kind of summarize some of the key findings. The questions that we're interested in, first of all, relate to trust as a concept. So one of the questions we had at the start of the pandemic was there a difference between these different concepts that are increasingly identified in the trust literature? So rather than just talking about trust, there's increasing discussion of the concept of trust, which is obviously kind of the standard way of thinking about these things, but also mistrust, which is the idea that citizens might be mistrustful of government and policy makers. They might be skeptical and watchful of how government behaves. And so that idea is more that actually perhaps some of the kind of normative ideas that trust is just a good thing are slightly misplaced, and actually we shouldn't always trust politicians. And I think certainly during the pandemic, one of the features of that kind of link between citizens and the state is that at times citizens are right to be cautious and be skeptical about whether policymakers are making the right decisions. And then the third concept we've been interested is distrust, the idea that citizens are kind of increasingly polarized, kind of effectively polarized, disliking of politicians and other parts of society. And so in part of the study, we're interested in whether or not there are differences between the trust orientations people have and whether actually that impacts people's behavioral responses to public policy. So some of the questions that we're interested in are things like, for example, are trusting citizens more compliant with government restrictions? That was always the assumption at the start of the pandemic, and I'll give you a little bit of a flavour of what we find. And similarly, things like kind of vaccination. We've done a little bit of work on vaccine hesitancy. It seems fairly definitive from all the evidence so far that institutional trust, but also other forms of trust, are really important for levels of vaccine uptake across the world, which obviously is going to be a crucial factor in terms of the kind of global response to COVID. So let me just say a few things around the findings from the study. This is just a bit of analysis. In some ways I say, don't worry too much on the precise details of the figure, that we're looking at questions around from national surveys in the US, UK, Italy, and Australia here. And we were first of all interested in whether or not these different sorts of trust, distrust, and mistrust influence people's perception of the national threat of COVID. This is from last year. And one of the things we find actually kind of almost is that the strongest effects seem to be around mistrust, that there are actually interesting cross-national variations. So, for example, we found that people who were trusting in Italy around the time of our survey actually had lower threat perceptions, whereas people who had higher trust tended to perceive the threat as greater in the US and Australia, for example, whereas people who were distrustful tended to perceive the threat as higher in the UK and the US. And so there are some sort of interesting variations there that we actually think that the context is really important. So, you know, in a context like, for example, Italy, which was hit very badly by the initial wave, but where the government was seen as to have handled it quite well, trust seemed to work in the traditional way that, you know, kind of high levels of trust meant people were more likely to high levels of were less likely to see a national threat, whereas in the US and the UK, high levels of distrust in government and politics tended to lead people to see a greater national threat. I think probably more importantly and more consistent in terms of our findings, we find that actually, in contrast to some of the existing literature, it was mistrust that was most important for people's behavioural adjustment. So in the surveys, we asked people how much they were adapting their behaviour, things like hand washing, face masks, social distancing. And we find that people who are mistrustful, were sceptical of information from the government, sceptical of the behaviour of politicians, were more likely to report changing their behaviour during this early phase of the crisis than people, for example, who are trusters. So actually, interestingly, across the 4 countries, we found that people who expressed trust in government were less likely to have changed their behaviour. That is actually kind of counter to the literature, in the sense that people would have expected that high levels of trust would be a good thing that would lead to higher compliance, but it suggests that maybe there was a sort of complacency associated with trust. And more consistent with the existing literature, we found that measures of distrust, so people's feelings of affective dislike for politicians and government, they tended to predict people who would respond less to the pandemic. And I think, so just to say a little bit about the UK context, I think as we go for a moment to where we are now in the country with rising case rates of COVID, people who are mistrustful, you can quite understand, might start to adapt their behaviour. It's almost sort of a rational expectations model of trust and COVID, that citizens, though it's not just simply that whether citizens trust or don't trust government, but citizens who are sceptical of government, who perhaps think they're not doing a good job, can take matter into their own hands. And I think that speaks very crucially to the question of governments often have, I think, treated trust during the crisis as something that just needs to be kind of kept going, and it's a good thing. But I think they haven't thought a lot about mistrust. So the UK government hasn't really thought about the importance of a lack of confidence in what they're doing, and that people will not just rush back to the shops and rush back to workplaces. Let me just say a final few things, because I'm always conscious that I speak too long, about some of the evidence from the focus groups we ran in the last year, that we started in England, but we've been increasingly conducted over a number more countries. And I think for me, the fascinating thing about observing how citizens responded to the pandemic in this qualitative context has been really important, because in surveys, you always get a sense of the kind of the national levels of trust, distrust, mistrust, how much of a threat people think COVID is. But in the focus groups, it's been really helpful for understanding how citizens make their trust judgments, how they understand concepts around trust, also how they understand the concept of the pandemic. And we had huge methodological challenges during the project as the pandemic hit, because we originally planned to do all these groups in person, and we've had to really kind of innovate and pioneer online focus groups as a means of engaging with citizens. But it has been incredibly fascinating, and also it created opportunities, for example, that we've sat in on focus groups with real-time translation in other countries. We've sat in on and facilitated groups in other countries that just simply wouldn't have been possible before. And I suppose what I'd say about the focus groups, I think in 2 key areas about the relationship between citizens and government in the time of COVID, that the evidence that those focus groups have given that surveys and other methods don't, is they've really exposed the importance of latent trust in government. The idea that despite the rise of anti-politics, distrust in politics, citizens believe that government is there to protect them. It kind of speaks to a much kind of earlier literature around diffuse support in regimes, the idea that citizens believe that a government wants to do the right thing. And also in terms of willingness to be vaccinated, we asked citizens in focus groups about how they understood information. And I think what's been really interesting there is understanding how citizens piece together information in an incredibly fragmented and complicated environment. And I think you don't always get that from what can look like conspiratorial beliefs, confusion and so forth, actually are often people trying to navigate complex, intense information contexts. So let me just say, I'm sure I'm going to start getting in trouble if I can't see you because I don't on the screen, but I will. I'll get in trouble for talking too long. So let me just say a final few things about the focus groups. You know, in the focus groups, on one level, validated what we found from surveys. So they validated that people are more willing to get vaccinated if they trust government handle of the pandemic. They're more likely to perceive government as having followed the science, because there's a trust in experts and science that's associated with vaccine willingness. But we often found that people who were hesitant about vaccines were often making their judgments based on quite understandable concerns, and the logics they used were not, really conspiratorial or incredibly distrusting. There were people saying they were concerned about the speed of vaccine development, which was understandable because it's been a huge achievement. Or they were related to misunderstandings of relevant concepts such as herd immunity. And I think maybe one thing I would say that COVID has been really exceptional as a concept, as a context of public policy, is that citizens have been paying more attention than they normally do to politics. And so one of the things we found in focus groups in the UK was that people really found these kind of daily press conferences, experts standing up and telling people how the pandemic was unfolded. They found them really useful, but it actually is a real contrast to how politics as usual. And I think that is where we should reflect on the difference of the pandemic compared to other areas of public policy. But I think what was really important was this idea that it wasn't about irrational thinking, conspiracy theories. People were trying to make sense of fragmented and confusing information about the pandemic. They've been bombarded with huge amounts of information about science, about this very uncertain thing that we're all dealing with. And so often what in surveys look like conspiracy beliefs, distrust, driving, practicing hesitancy, are often people struggling in a very complex, emotive, intense situation. And I think the other thing that has been really important is the evidence of diffuse support for government in times of crisis. Despite people having huge numbers of specific complaints, we would ask people about how they thought government was handling the crisis. And this was true across many countries. And they would reel off all sorts of examples about areas of failures in public policy. But once you cut beneath that layer, people would express things like they thought the government was doing a good job in the context. So for me, I think, just to close, the pandemic has really exposed the challenges of governing in the 21st century, not all of which are new, but I think it has given us great clarity about some of the challenges that citizens have in a highly information intense environment, but it's also it's allowed us insights that we wouldn't have otherwise had about that diffuse nature of support, about how people operate in context with huge amounts of information. And I will stop there.
Thank you very much, Will. That was fascinating. I think it's time to pass it over to Olivier.
Yes, thank you. Thank you, Isabelle. Before I share my screen, I just want to thank Isabelle, Philippe, and Grace for the invitation and the opportunity to participate in this roundtable. I also want to say that I fortunately don't have to answer the question what I'll be teaching in 20 years, because in 20 years I'll be retired. But I expect that we will look back on this crisis as the first of a series of crises, which thus begs the question of how we learn from these situations, from these crises, and both in terms of crisis management, but also in terms of policy making. So my presentation will be based partly on the book that Isabelle very kindly presented earlier, which came out last October, but which we wrote actually last year, about 1 year ago exactly, which, so as the title suggests, looks at the crisis and the way it was handled in France. So this is a French case study in France as a very, and from an organizational point of view, we are organizational sociologists. We are interested in how organizations operate, in particular in crisis situations. And so we wanted to sort of make sense of a series of surprises and odd choices that had been made in the early stages of the crisis last year. So, wait 1 second. So so I'll be basing my presentation today on both on the book, also on interviews we've conducted since the book came out. We thought the book would close doors. Actually, the book has opened many doors, and so many people have agreed to interviews with us, and we have thus been able to further our analysis of the situation, of the choices made not only last spring but also with the second and third lockdowns in France. And currently, we are working with a team of colleagues on a research project finished by the French National Research Agency. And the project is called Organizations in Crisis, and it looks at how organizations both at the national and local level in France handled this crisis situation. So what I would want to start off with is from a policy making, from a policy analysis point of view, two sets of surprises related to the way the crisis was handled in France, but I suspect in many other countries as well. First is preparedness. So the first interesting surprise is the fact that France, like many other developed countries since the early 2000s, has invested massively in crisis preparedness with dedicated organizations, specific regulation, emergency management plans, surveillance systems, exercises, et cetera, we have set up a whole apparatus, set of instruments and frameworks to handle coming crises and be prepared to manage them. And in many respects, crisis preparedness or emergency preparedness has become a new policy domain in its own right. Yet, what is surprising is that France, like many other countries, when the pandemic arrived, seemed really unprepared. And what we witnessed, many decisions that were largely improvised on the part of the government. And in the book, and since then also, we try to offer different hypotheses as to why the investment in preparedness did not pay off when the crisis actually came out, and why we very largely improvised. Some of the explanation has to do with concepts defined by Diane Vaughan in her book on the Challenger accident on organizational drift and normalization of deviance, in the sense that there was a sentiment, a feeling of being prepared, of being able to manage such a large crisis if it occurred. And in a sense, the fact that we seem prepared sort of led through a series of small, very discrete decisions to invest less in preparedness and to focus more, for example, on other types of crises, in particular terrorism. And what we show in the book is that the pandemic, the COVID-19 pandemic, represents what François de Dieu calls a treacherous risk. It's a risk that we are familiar with. When the first signs have come out from China in January, most of the experts in France and elsewhere also see this as a seasonal alert. We have every year at the same period of time alerts of the same type, and usually they don't turn out to be big crises. They don't turn into big major catastrophes. So there's a sense of familiarity, which then suggests that we are ready to handle this, and that in any case it probably won't be that bad until the moment when we realize that it is actually much more serious than expected, and then at that point we have to take radical decisions. Other elements of explaining why we seem so unprepared is the fact that in the French situation, at least, there is clearly a lack of trust on the part of political authorities, the government, the president of the Republic, towards their own administration, and they want to manage this crisis apart from their own administration. And more importantly, they also want to manage this crisis without being burdened by administrative routines, procedures, and struggles, which leads to the creation of a whole set of new organizations and agencies on the side, apart from existing organizations and agencies in charge of crisis management, because political authorities want to remain in charge. And the second element of surprise is the lockdown. From a policymaking point of view, once again, this is quite, I think, a rare, maybe even a unique situation where a decision is taken based on a solution that has been unplanned for, never tested. We don't know what its effects will be. It comes out from nowhere. And it is adopted in a very short period of time. And there are not too many examples in policy making of such radical, unknown decisions. And there again, in the book, what we try to show is that it's important to understand the conditions under which this solution was adopted. Both the phenomenon of elite panic, as Lee Clark would say, and Sharon Chess, in the sense that the government realizes on March 12 that the situation is much more dangerous than expected, and they're not ready. They don't have the material to face the crisis, and so they have to adopt a radical situation. There are also other elements of the framing of the crisis by the Scientific Council as a medical crisis that focuses mostly, even uniquely, on hospitals, leads to the only solution possible to protect the hospitals. And there's also the element of mimetism. I'm going very fast on this because these are elements of the book. I can come back in the discussion, but I just wanted to stress the fact that here we have a unique situation where we adopted a radical solution that had never been tested before. We never planned for it. We don't know what it does. And I expect that in the future, we might have similar situations coming up. So what now, I mean, in terms of what should we do based on these surprises? Should we continue to invest in crisis preparedness? I think this is an important question for many of our countries. And if so, how? As a distinct field of activity or as part of the normal operations of many organizations? And I think the real challenge is how can we avoid finding ourselves in the future with a similar situation where we have to make a radical decision with severe implications in terms of civil liberties in a very short period of time. The second point I want to make, which goes, I think, partly to some of the points made by Will, is the fact that in many respects, what happened during the crisis is not so different from, at least in France, from normal policy making. It simply exacerbates many existing traits in the French decision-making system, in French administrative polity. And these are of various sorts. First of all, there is what we call now a neo-bureaucratic vicious circle. The fact that we have many organizations that either existed or were created during the crisis to handle the crisis. And given that this led to problems of coordination, the answer was to create more organizations to coordinate the existing organizations in sort of a bureaucratic vicious circle where we invent new organizations all the time to try to coordinate a large set of organizations that work very, very autonomously. We also witness a very hyper-centralized decision-making. France, as you know, is a very centralized country. In the crisis, in the management of the current crisis, this has led to hyper-centralization with decisions being taken by the President of the Republic in a small committee every week since last October, which is something unheard for, except in periods of war. Another element of exacerbation is the fact that the management of the crisis is really centered on the state. And the state has largely handled the crisis by itself, with its own means, leaving aside or not relying upon many other possible actors, civil society organizations, professional organizations, local governments, that actually did play a very important role in the crisis, but these were not linked, these were not coordinated with government intervention. The state really managed the crisis and claimed monopoly on the handling of the crisis. Another element of exacerbation is the fact that, as in normal times, but even more now so in a crisis, we found many decisions being taken at the top level of government with no consideration for their implementation, which of course led to problems when they were implemented, and then failures or difficulties or dysfunctions, which were then blamed on bureaucracy. And this is very clear in many of the decisions taken last spring, where the authorities, with their experts, were taking decisions often on very minor, small issues, but with never any knowledge of how they would actually be implemented on the ground, and which led every time to great difficulties and the necessity to adapt to these to local conditions. And finally, a last element, in France, we are very bad at evaluating policies, public policies. And in this case, once again, there was no evaluation whatsoever of the impact of the measures taken. No evaluation of the impact of the lockdown, both in terms of did it have an effect on the circulation of the virus, but also what other effects did it have on the economy, on the society, or even on health issues. There's no evaluation, and more than a year after now, a year and a half after the lockdowns, we still have no evidence that the lockdown actually produced an effect on the virus circulation. So what now, again, what are the implications for studying policymaking? First of all, I think we need to reconsider that crisis as distinct from a normal policymaking. Following Michel Daubry's continuity hypothesis, we need to consider more and more crises as just the continuation of the normal functioning administrations, normal policy makings, with exacerbated traits. And we also need to consider that policy choices, many policy choices taken in times of peace, quote unquote, actually have consequences in terms of crisis. And so that crises are not something distinct, separate, extraordinary, apart from the normal operations of government. And finally, how do we draw lessons and how do we train officials to manage crises and more generally to handle such complex situations? In the case of France, at least for the moment, there is no current plan to organize a general retour d'expérience, as we say in France, or a general hot wash. So there will be no lessons or very limited lessons drawn on the handling of the crisis in France. And should there be a tentative to do so, actually, we have no real methodology to undertake such an exercise. And in the book, we come back on the limits of many of these post-crisis reports and inquiries that tend to focus more on what didn't work than actually on what worked and why did cooperation emerge, for example, in places where usually there is no cooperation. I think the question of lessons also relates to another problem, which is accountability. And it's interesting to see in the French case how much many of the decisions taken, many of the instances created for handling the crisis have left no trace of their decisions, of the discussions. I mean, they of course have decisions taken, but the discussions that led to the decisions have not been written down. There are no traces, which is clearly a way of avoiding future issues of accountability in front of courts, but it is a real problem in terms of learning from this crisis. And finally, there's also a desire to preserve existing institutional arrangements, and so to close as quickly as possible the current crisis and go back to the normal operations of the administrations. And so how do we train future policymakers? Well, in the book, we also suggest several important ideas. First of all, we need to have policymakers that are more familiar with the scientific methods of reasoning, which is not the case in France. As you know, in France, most political elites have never been to university, don't know what research is like. So they have no idea of what a scientific reasoning is. They have a very naive understanding of science. We also need to train future policymakers to issues of complexity, to undertaking inquiries and understanding the logics and the dynamics of policy problems they have to solve. And I think we should rehabilitate case studies in the training of future policymakers. We in France, for the moment, tend to focus too much on exercises, simulation exercises. And I've written several papers showing the limits of exercises. And I think we need to recourse to case studies as a way of being able to understand more in depth the complexity and the thickness of these crisis situations and how they are handled. And so to conclude, I think what is really important, this is why once again I stress and I want to insist on the fact that we should not distinguish crisis management from normal policy making. In both cases, what is at stake from the point of view of the state is not making decisions, it's not taking decisions, in particular in the case of the crisis, micromanaging the crisis, but it's really about creating the conditions for actors to cooperate and to coordinate their actions. I think this is really what is at stake and what has not been the case for the moment in the French situation. We have a government that is too much focused on taking very small decisions and on systematically confusing strategy with tactics. I think we also need to consider that the solution is not creating more organizations, more procedures. What our research shows, both in last spring but also since, is the fact that cooperation emerged in cases where constraints were lessened, were relieved, on the interactions between actors, and additional resources were provided to them. And this made it possible for cooperation to emerge. So it's not a question of organizations, of procedures, it's a question of understanding the dynamics of power relations and what makes individuals agree to cooperate when on a normal basis they are in conflict and competition. And finally, a last point is the fact that we need to think in terms of interdependencies. What we see during a crisis is that cooperation relies on interdependencies between actors that pre-exist the crisis. People know each other, they've learned to work together, they depend on each other, they know what resources they control. And so in this case, it becomes possible for them during the crisis to reorganize their relations and to adapt, to improvise according to the situation. But this is a problem because many of the reforms, and this is my last word, many of the reforms undertaken over the last 20 years in France, like many other countries, have led to the creation of multiple organizations in terms of specialized organizations, agencies that are accountable, that are traceable, that are transparent, etc. So we have this multiplication of organizations in states Same thing as in private sector. But what we see is that when a crisis comes, this becomes a real problem in terms of coordination. How do we coordinate such a large number of organizations? And what the French case shows is that the only solution in this case is to create other organizations on the side to try to handle this complexity, which is, of course, not the real answer. I will stop here and thank you for your attention.
Thank you very much, Olivier. That was very, very interesting. Thank you so much. All right, I think we have lost Paola, so I think maybe we move to Mireille. Mireille, are you ready to present? And then we will go back to Paola when she can join us again.
Hi, everyone. Hi, Isabelle. Allow me to thank you very much for bringing me into this important discussion. Thanks to the organizer for inviting me from Yaounde. I'm happy to be here and share a little bit my African experience with you. So my presentation of today is will not draw from a completed study. It's really exploratory, basing off some inconsistent observation of few African countries, and but with a focus on cultures and identities, how cultures and identities shape the crisis policy making, the level of economic development, because I think these are elements, variables that to taken into consideration when we talk of a particular historical context, which is Africa. Another variable I have looked at is the robustness of health infrastructure, as far as this is linked to the economic development level, and governance also, and level of democracy, I think have affected the state's responses. The type of political regime, a little bit, as far as in some democracies, whether in Europe, Western countries, or in Africa, has faced the challenge of complying individuals. So having this, I've looked particularly at the activities carried out by states at the regional level through regional organizations, or other forms of initiative, interactions with the outside world. You understand why when I come to what should we think about when we talk of African state response or the African context. So interactions with the outside world, which serve to put in the role of donors in that crisis policy making process, the important role, determining role of international organizations, but also the renewed role of Bretton Woods institutions. Observations to have some figures, information has focused on the media, some organizations report, such as the African Centers of Disease Observation and think tanks report. And also few informal conversations that I had with some African compatriots, Cameroonian compatriots living in different countries, African countries, to whom I asked questions about the health robustness in the country they live in, the role of international donors, mobilization of civil society, and states' innovative strategies. You understand why? So I just focus on those questions. So, talking about the African context of the COVID-19 crisis, I want to come back to the figures, to the number of cases. I think all of that is available on John Hopkins' website. But I want to focus just to talk about what we should have in mind when we talk about Africa is surely the second largest demography in the world, but with the lower number of cases regarding the COVID-19 responses. Is the number of 56 states with 54 members of the African Union, which is the regional organization, a kind of European model. It's a continent with diverse countries, with economic disparities, various types of interaction with the world. You understand when I will talk about the nationalism issues that rise from this crisis. Also the aspect solidarities and underlined economic issues, like a kind of new market that emerged in that process of COVID-19 fighting. I did not specifically took a look at what we may call the non-pharmaceutical initiative that we found everywhere around the world, such as the wear of masks, hand sanitizer, social distancing, hand, etc., because I think it's very general and it can be found anywhere. I defined the COVID-19 crisis departing from Michel Dobry's definition of what crisis is, like a problematic situation. You understand why I focus on that. Problematic situations which affect structures or the organization of the society, which request change or radical change of mentalities, adaptation, policy design, representation, paradigms. Something which mark, I depart from that definition of Dobry to posit the context of the crisis as something which mark the passage from routine situation to deep critical economic situation or condition, which has main consequences, the rediscovery of institutions, their structures, actions, organizations, and reconfigurations. The COVID-19 crisis in Africa, therefore, has therefore put in various types of dialectics, what I call dialectics that turn between deconstruction and reconstruction, and which come along with various forms of the reconfiguration of the policymaking process. So, talking about the actors is not so clear, but there are some elements missing. But it's just to give you a look about the kind of where the source of where the responses came from in the African context. So in the African context, we had various state agents. When I'm talking here, I'm not talking in a global context of Africa. From state within state, we had at the same time state agents, state communities, civil society, expert, laboratory, citizen, regional international organizations, international norms and practice, and reimagined and reconstructed ways of doing. There is a kind of interactions between those different actors and instruments. What we've realized regarding the new policies and the new forms of institutional interactions, about the different reconfiguration that we've not noticed when introducing, there have emerged new types of social relations, not about the social distanciation, but something else that you understand. New health policy, for sure, in different African contexts. And we've seen, for example, in the case of Ghana, that had a focus on the primary and high school education, adopting specific measures. We've seen in case of Cameroon, a global plan for a 3 years period with a focus of reinforcement of health institutions, the reinforcement of the rebuild of laboratories, etc. In Morocco, countries like Morocco, there has been a particular focus on the disciplining individuals. And maybe I talk about the political regimes. What you should know is that Morocco is a monarchy, constitutional monarchy in terms of regime. In South Africa, what was impressive, and which is one of the most developed African countries, it has been that kind of focus on policy different stages of the policy-making crisis, step by step, whereas in countries like Cameroon, there has been very spontaneous action, announcing the crisis, the problematic situation at 1 p.m., closing the borders at 6 p.m. the same day. So these are the kind of differentiation that we have observed around across the continent. What was also interesting in terms of the policy-making process is this kind of intensified interactions between technical, bureaucratic, administration, bureaucracies, state administration. What was interesting in the case of Cameroon, for example, is that intensified interaction between the health ministry and the Ministry of Research, Scientific Research, and the Prime Minister, whereas the head of state never said a word about the crisis. The contrast was observed in South Africa, where every time the situation appeared critical, is the head of state who took the floor to try to assure the population to sensitize. And a different reconfiguration also regarding the state expertise. I think this is the best lesson that the crisis learned about us. We have seen a kind of dislocation, if I can call it like that, of state expertise. In the context of Cameroon, for example, where is the expertise is too close, is very close to the institutions. We have seen a dislocation at the society level, where the Catholic Church has played a big role, an important role. That's not all. What was interesting in that case is that apart from the protocol brought in by medical, if I can call it like that, medical expertise, scientific expertise, affected citizens were taking both the medical protocol given at the hospital and the medicinal products brought up by the Catholic Church. What was surprising is that the product brought about by the Catholic Church was sold expensive, about 30 euros, whereas the state medicine treatment was free. But citizens were thought that it was important to add to that state's recommendation the religious. There's a kind of dislocation of trust. But what was also interesting is that for those who were affected, the kind of advice they had from other citizens, like, okay, not only drink the medicine, you should pray a lot because it's God that saves from that disease. So it was very, very interesting. In the case of Senegal, what was also interesting is the transnationalization of expertise. Whereas in situation such in case like Cameroon, there has been a internal focus interaction between the state and society, state and communities, different communities try to find a solution. At Senegal, which is known in Africa like what we call a most open, Senegal is like the most open country to the world, has called for the French expertise to work in partnership with a scientific committee in Senegal. So I think there are so many things reconfirmed at different levels. And one of the other points I want to focus on is the regionalism. The regionalism has an issue, something new brought by that crisis, but also something problematic, the denial of the global expertise. There have been many cases regarding the vaccine. Morocco has made every effort to try to organize the production of vaccine in its own country. Ask why? Because there has been a social denial, population refusing to get vaccinated because they said we are not trusting regarding all of what we are hearing about from the media regarding the vaccine, the bad effect of vaccine at Europe, we don't want to be vaccinated. So they constrain the population, the state, to try to reinvent, to organize a kind of expertise within the country. We see also, maybe I will close by that, the case of Madagascar, which was very interesting, about the Artemisia CVO, which has been expertised by the World Health Organization, and which was like also a denial to the global expertise coming from abroad. But from talking about the regionalism issue, what is interesting is that Madagascar has tried to mobilize African states, but there was no solidarity coming from, it was not followed by other states. So maybe the time is behind us, but what we can keep and maybe can push forward, like future research, is about those forms of solidarities created by the crisis, but also problem. I talk about governance, but I did not have time to mention it, but which I think is a very important issue, the new markets that emerge from the COVID-19 crisis. You know, many African states, such as Mali, Cameroon, receive important financial aid from Bretton Woods institutions. And in Cameroon, one of the there has been COVID scandals brought out by the Ministry of Health, Public Health, and the Ministry of Scientific Research, which went on trial, and who are waiting to be judged because there have been kind of embezzlement, governance embezzlement. I don't know how to really translate it in English, but embezzlement, bad governance, economic governance. They receive money. There have been a lot of money. There are things to be done that were not done. And we had like such issue like COVID gates that came like an important economic challenge. So Isabelle, maybe I'll stop here to give the possibility to people, to the public who is there with us to ask for questions, if there are many things to do. But I think the main word to keep in mind is reconfiguration of interactions, rediscovery of institutions, where the institutions lie in, where to go, where to find out the policy making, the crisis policy making process. Thank you very much for listening to me, for giving me this opportunity. I'm looking forward maybe for questions if there are. Thank you.
Thank you very much, Mireille. I gave you a huge task to address the entire continent, Africa, and I think you have been wonderful with this task. So thank you very much. I believe we have Paola back. Yes, we do. Hello, Paola. It's very good to have you back with us.
I am. Can you hear me?
Yeah, I think you need to speak maybe a little louder.
I hope that you can see it, right?
Yes, we can see it.
Okay, okay, good. Okay, thank you very much. So so my task here today is to talk about public policy in relation with gender equality. So during COVID-19, one of the most important aspects of the pandemic is related to gender differences. So the pandemic had a different impact on men and women. And this is under several dimensions, but also in terms of public policy, we can learn a lot with relationship to gender differences. So let me show you some evidence, and then of course we can discuss a little bit better what I have in mind. So first of all, we know that the COVID-19, the crisis, so the health crisis, which also.
All right, I think very good. Okay, this is really the little perks of being hybrid and all connectivity. Jay, would you like to present by any chance?
Sure.
Wonderful. Yeah. I have already introduced you before you join us, so it's a real pleasure to have you. And I think the floor is yours.
All right. Okay. Well, I will talk a little bit about, first of all, sorry for the time confusion, but it's great to be part of this wonderful panel. And I'm sorry for not being able to be in conference physically, but it's a great roundtable. Well, as we all know, there are great challenges that we all experiencing. And we thought initially, well, 1 year we'll get it done, but now we still have problems. So there are a lot of challenges to public governance and public policy. All governments are being tested simultaneously, exactly same problem. Some countries are doing good, relatively speaking, and some countries are doing poor, while some countries initially doing good and then poor. So that it's really difficult to predict what will be unfolded. Well, some countries, particularly many Asian countries, have experienced SARS, for example, and MERS. So that wearing masks and then infectious disease like COVID-19, relatively speaking, sort of used to it. So that I don't think there's a strong resistance from the citizen side, wearing masks and social distancing and things like that. I think there's some advantage by having some similar experiences this part of the world. Well, this is the one that I drew 2 days ago, and x-axis is basically the ratio of confirmed patients out of how many tests made. So, for example, South Korea, where I live in, and 1 out of 100 tests, you may see the confirmed cases. So that the approach is aggressive testing. So that really try to testing and then separate from the confirmed patients, infected patients from the public, and then treat them as quickly as possible. And here, y-axis is the fatality rate. So that there are some countries, there's pretty wide variations in terms of the way they testing people and then really managing the patients. So that I think that lead to some policy outcomes we see. At the same time, the question is, what really determine the different policy responses by different countries and then outcomes that we see? Well, this is the comparative perspective of different countries just came out last week by Pew Research Foundation. And here you see that there's some survey done by people in living different countries. So that here, how governments are handling. So it's how good effectively handling COVID-19. So that some countries, people say, well, their governments are handling pretty good. And then some countries saying that, well, not good. Well, just note that this survey was done last summer, so that 1 year ago. So if you do same one, and then you'll see different picture. And another one, the bottom is which country is more united, having the COVID-19, and then which countries are less united. Some of the countries, more unified out of the COVID-19 issues. And then, for example, US, the countries are more divided. And Korea, I would say, well, it's doing good in terms of responding to COVID-19. Initially, well, they are well unified, but ideologically, there are still, variation among the people, particularly facing new presidential election next year, so that it's getting divided again. So I think there are a lot of political and policy context that we should take a look into. Well, alternative explanations for variations in COVID-19 mitigation performance among different countries. Well, government dimensions, leadership matter, administrative culture matter, government capacity matter, political administrative system, institutional arrangement matter, agility matter, digital government, information technology application by the government matter. Well, there are other social, political, economic dimensions as well. GDP matter, democratic systems, citizenship, particularly communitarianism matter, population density, of course, because of infectious disease, aging population matter, and that's very closely related to the fatality rate in many countries. Healthcare system matter, so that there are many different things that we should take into consideration. Well, of course, I cannot touch upon all of the components, and I just want to highlight based on some of the research I have done. Why are we troubled? I just want to borrow the quote from Albright, former state secretary in the US. We are taking 21st century challenges, but evaluating them with a 20th century idea and responding them with the 19th century policy tools. Well, probably that's something that we have been observing. Problems are very much like wicked problems, but in institutional arrangement, legal arrangement we have, and ideas we apply to might not be appropriate. And policy tools might not be appropriate either. So do institutional and legal arrangement matter? And of course, in institutional arrangement, there are different options. We have hierarchy, hybrid, network in governance structure. And I had, comparative study on Korea and Japanese policy responses to COVID-19. And here, Japan and Korea and Japan, we do use centers of government so that for policy coordination among different ministries at the same time, different local governments, so that it's similar in having centers of policy coordination organizations. In Korea, Central Disaster and Safety Countermeasure Headquarters. In Japan, Novel Coronavirus Response Headquarters. Very similar. The difference is that Korea has a Korean version of CDCs, so that Central Disease Control Headquarters. Now this is upgraded to agency level. And then Japan, they do have Research Institute, National Infectious Disease Institute, which is not administrative body, but research body. So it's good to have centers of government, but they don't have really centralized the system. So that on the one hand, you need a network structure. At the same time, you need the centralized policy responses, particularly responding to COVID-19. Well, this is one experimental design I had. The result I just want to share. I had a vignette-based experiments, and the experiment, there are two scenarios: one routine disaster, and then non-routine disaster, like COVID-19. Routine disaster is like a flu kind of thing. It's annually you have, and people prefer having network structure rather than centralized structure. That's a first finding, and then we try to look at what about level of severity, and then level of urgency, and then level of uncertainty, how that matter. Our finding is interesting because network governance structure is preferred in case of a non-routine disaster, but a higher degree of severity and then network structure is preferred. But if you have higher degree of urgency, and then people prefer centralized structure. So that I think we do have mixed findings, and COVID-19 issues. I think we on the one hand we have network structure like a centers of government. At the same time, we need a centralized response institutional arrangement for handling that. Another one I just want to say a little bit is communitarian values, and I just want to get a quotation from the work by Edimo, sociologist. The world's most communitarian countries are handling the pandemic better than others. And I think there is ongoing debate, individualistic countries versus communitarian countries. Of course, it's a fuzzy definitions, but I think it's really important to have communitarianism, communitarian citizenship, and participation in NPI, non-pharmaceutical interventions, such as social distancing and wearing masks and things like that. Another point I want to touch upon is agility issues. Because of the fast spread of COVID-19, agile response is very, very important. At the same time, policy learning is also important. Agility matter. Well, take a look at this Google image agility. You'll see, first a sprint training, you'll see these images, running fast, start, fast, and then strength. That's the sprint training images. Agility training is this. You have zigzag and then moving, right and left. And so that the difference between sprint and agility, it's not only speed, but also flexibility, and then overcoming the barriers that we see. So that there are a lot of unknowns on COVID-19. So that particularly for the first year, agile responses and changing and adaptive approaches was quite important. And take a look at this one. I tried to measure the agility perception on agile responses by government, and then how they feel about the COVID-19 and how, to what extent they worry about COVID-19. Here you have 3 different groups. Green line is those who have higher public trust. And then blue line is low level of public trust. And then red line is the middle group. So that those people who have high level of public trust, as they see governments are very agile, and then their anxiety level goes down. But those people who don't have good trust in government, as they feel like a government is so agile, and then their anxiety level goes up. So that here you have agility versus stability. What kind of things that people want to see? So that was last year's survey for 1,000 people. And then this is the right-hand side. That's this year's graph. And then this year, regardless of the level of public trust in government, as government, they perceive high level of agility, and then people's anxiety level goes up. What does it mean? When people do not know much about COVID-19, and then agile responses was perceived good, particularly for the people who trust in government. But now this year, we know pretty much about COVID-19. People do not want to government agile. They want to have stability rather than agility. So that, I think that really offer a lot of implications. Well, there are a lot of policy tools, very restrictive sometimes, financial support for resilience reasons, and then public information campaign. A lot of policy tools are used by different countries. We still don't know which policy tool is more effective than others. Well, still Tom and Jerry game we have. Well, my last one, solving wicked policy problems. Well, together with agility and resilience. I just want to get another quote from Einstein. Life is like riding a bicycle. To keep your balance, you must keep moving. Thank you.
Thank you very much. That was very insightful. I will try to remember that to keep my balance on a bike. I should keep moving. That's maybe sometimes the problems I have in life. I believe we have Paola back.
Yes, can you hear me? Yes, I am back. Sorry, yes, it seems very problematic today. Okay, so if you can share my slides that I just sent you, so it's going to be better if you do it. So I was telling you that, COVID-19 had a strong impact on women, much more than on men. In particular, when we talk about the labor market, so this is not only because women are in general more vulnerable on the labor market, but also because they are employed in different sectors, mainly in the service sector, which is strongly affected by the pandemic. So differently from the financial crisis, let's say. So if you go next slide. Which basically was very strong on the finance and industry, so where mostly men are employed, so it was a kind of man session. The COVID-19 has particularly hit women and women's labor market, but not only because of the sector. There is another element which is particularly interesting, also related to the policy that we may think about gender equality, which is the fact that family responsibilities during the lockdown have increased, and they have not been equally shared between men and women. So if we go to the next slide, I can show you some data. These are data from Italy, but there has been around also a lot of evidence from other countries. So similar evidence also, for example, for the UK or Spain, etc., where basically what we did, we interviewed a survey on 1,000 representative women, and we asked them about the amount of time they devoted to housework, childcare, and distance learning of children before the COVID, during the first wave, and during the second wave of the pandemic. And actually what you see clearly is that women increase dramatically the amount of time. This is, we show daily hours. During the first wave, the amount of time they spent in housework and childcare. So it's really increased. Before the COVID, the women spent 2.3 on average daily hours, and they in wave 1 3 hours in housework and childcare, from 4.2 to 6. While their partners also increased the job, the duties, but not as much as women. And during the second wave, there was a decrease, but not going back to the original situation. So, this seems to suggest that differences between men and women are going to be exacerbated, and we need some policies to establish a little bit, equality, even though. Of course, it's difficult because we also talk about a situation which was there even before the pandemic. So the pandemic seems to have exacerbated gender gaps in family duties, in tasks. Another important part of the story is, of course, that during the pandemic, we have experienced this strong amount of remote working. Okay, so working from home, working remotely, which has been exceptionally huge. This was there even before, but really to a small amount, much more limited amount. So we are talking about men and women who work from home, and actually this in principle has the potential to rebalance a little bit the responsibilities within the family, because even when men work from home, they are more involved into family activities, household and childcare. So in the long run, probably we will see this type of effect, but for the moment, in the short run, from this data and also other surveys that you can find for other countries, it seems that this is not still the case. The second piece of evidence, and next, please, that I would like to show is what happened with how we call the female leadership. So you have certainly heard. So if you can go to the next slide, that during the pandemic, men and women leaders in of countries have performed differently. Okay, so countries led by women have performed differently than countries led by men. Why? Because they have implemented different policies, or because they had a different style of leadership in terms also of giving information, of saying the truth, and so far and so on. So we know a lot about this, let's say, anecdotal evidence. But in terms of, giving you some data, what I show you in this picture is elaboration of data based on the Oxford database. And basically here you see on the left, male-led governments and female-led governments. governments, how they compare when we look at the closure of schools. The closure of schools has been one of the major, more important measures taken in terms of public policy. And you see here, there is an index of school closing, and you see a lot of differences. So it seems that male-led governments have closed schools more than female-led governments. Of course, this is a simple correlation so far, so we are working on trying to make some causal statement also in relation with this evidence, but it seems to suggest, and this is a kind of lesson from the COVID, that men and women, when they act as policymakers, when they lead the country, may implement different policies. So this is also taking into account, the seriousness of the pandemic and so far and so on. On the right, you have, again, a comparison between male-led governments and female-led governments with respect to the so-called income support index. So it seems, again, that women have an index which is higher when it turns to income support. So somehow this is going to suggest, the pandemic, that there are differences between men and women when they act as leaders and as policymakers with respect to at least schools and income support, which are, things that where women seem to be more sensible. There's a lot of evidence and a lot of literature in around across different disciplines related to performance of men and women when they are policymakers, and so there is a contribution of these studies during the pandemic in this direction. So if you can go to the next slide, we have a very similar graph, but in relationship with the share of ministries or women in parliaments, rather than just the head of the country or the head of the government. Next slide is the third piece of evidence that I would like to share with you, which is based on, so if you can change the slide, please, on a large survey that we performed during the pandemic, covering 8 countries, Australia, Austria, France, Germany, Italy, New Zealand, UK, and US, for a total of more than 20,000 respondents. And this was done during the first wave of the pandemic, but in 2 separate moments in 2020. And basically, during that, in this survey, we measured perceptions and attitudes and behaviors of men and women during the pandemic. So this relates also to our first presentation this morning. And the first evidence that I show you, and this is the next slide, please, is related to perceptions. So we ask whether COVID has serious health consequences, and if you look at these graphs, in all countries, women believe that COVID has serious health consequences much more than men. This is true for all countries in this survey that we conducted. Actually, what I'm telling you now is part of a paper which has been recently published by PNAS. So there is a huge difference. When you control for different characteristics of individuals, the thing that really matters is gender. So women perceive COVID as much more serious thing in terms of health consequences than men in all these countries. And the difference is significant, always statistically significant, and quite big. Next slide, please. We move to agreement with restrictive measures. So there is a list of measures which have been taken in terms of policies from the countries during the coronavirus, like closing daycares, closing stores, postponing elections. So you have the list over there. I'm not going into details of that, but you find the details, of course, in the paper and in this presentation. So a list of measures that countries have taken in terms of public policy interventions to deal with the COVID crisis. And when we also, so we build an index of agreement with these restrictive measures. And again, in the next slide, you can see there is a huge difference between men and women with respect to agreement with restrictive measures. So women agree more than men on with these restrictive measures. This is true in the pooled sample and also country by country, and it's also very strong. And the last piece here in the next slide is when we measure compliance with the restrictive measures. So not only it seems that women agree more with these measures, but they also comply more. So now we ask if they comply with the measures that have been implemented, like washing your hands, coughing into the elbow, stop greeting other by shaking hands, keep a distance, and the typical things that we got used to during the pandemic, and then also wearing a mask, wearing gloves, etc. So we also build a compliance index based on these measures, and in the next slide you see again the difference between men and women. So women complied more than men with these restrictive measures, and this is true in all countries. I mean, there is some variation across country, but the general message is that this is true in all countries. So in the next slide again, I will give you just an idea of the analysis that we did, because there's differences. So in these three areas, serious health consequences, agreement index, and compliance index, we also control for other social demographic characteristics, and the difference is still there, both when we use the first wave of the survey and the second wave. And we also control, so socioeconomic controls are the typical age, married, children, education, occupation, income, and geography. And the second, we also control for the so-called psycho-behavioral controls. For example, a measure of risk aversion. So it seems that also when we control for the fact that men and women are different in terms of a risk aversion, for example, or probability of contagion, because we know that women have died less than men during the pandemic, how much they are confident in science, their political ideology. So we include a lot of these controls, and still the difference is there, and this is significant. So let me conclude with the last slide. What have we learned from COVID-19 with respect to gender differences and public policies? We know that the health shock has affected men and women differently, and in particular, as I told you, family relationships. So in the long run, this is going to have serious consequences, and we have to think about the role of public policies to deal with these consequences, because of course we don't want to exacerbate even existing gender gaps, which are very strong already in several countries. Second, we have learned that men and women as leaders of a country, as policymakers, may have implemented different policies. So there are different policies implemented by male and female leaders. And third, we have learned that men and women have a different perceptions and a different behavior. And I think this is also particularly interesting when we talk about trust, when we talk about, agreement with the rules and compliance with the rules. And actually, I don't have time to show you today, but there is also difference, for example, in terms of vaccine hesitancy. If we want to refer to the first presentation, but actually in this case, it's going in a direction which is probably a little bit more puzzling, because we find that women are much more hesitant than men in terms of vaccination, which is typical. In the literature on health policy, that women want to vaccinate less than men. But in this particular case, given that they think that it's a more serious issue and that they want to comply more and to agree more, etc., it's probably something that we need to investigate better in order to gain more knowledge on the role of gender differences in public policy and lessons from COVID. Thank you very much, and sorry really a lot for my problems of connection. I hope that you could follow a little bit the presentation. Thank you.
Very much, Paola. We actually heard you loud and clear, so we really could follow perfectly well your presentation. And I see you double of my screen, so you have managed to magically be double Paola on the screen. So I think now we're gonna open the floor for questions. As you know, we have people in the room. I can vaguely see you from the back, and we have a lot of people online. So we have decided that we are starting with the questions in the room in Barcelona for the lucky ones who are there, and Grace will collect the questions I think you have mics on the side of the room that will help you to formulate your question in a way that for the people online we can hear. If you want, you can introduce yourself for your question, and then I will move to questions in the chat or in the Q&A function on Zoom. So fire off the questions on the chat. I will read them, and Grace is leading for the questions on the floor.
Okay, do we have any questions? We'd like to take 2 or 3 questions. Yes, Anna, can somebody bring a speaker, a mic to Anna? Yeah, there's one.
So thank you very much. Can you hear me outside there, all over the world? Isabelle and colleagues, lovely. Anna Dornova, my name. I have a question for both Olivier and Will, and thank you very much for your insightful presentations, but it might be that also the other panelists have something to say to that. It seems to me that your 2 stories show us, like, well, talking about the mistrust, also not only trust, and also talking about those who were actually not fearing the lockdown, but were fearing the openings. And Olivier talking about the wonderful plan of French government to anticipate crisis, and yet everything actually goes the very different way. And then at the end of your presentation, you were mentioning that actually there is something deeper in the French government practices which lacks some systematic evaluation. I think both of you are actually taking or inviting us to take a critical, or inviting the policymakers to take a critical step back, to look the other side, like not only trust but mistrust, not only openings, but not only like policy formulation and proposal and crisis plans, but also evaluation of what happened. So my question, I guess, is how can we teach this in 20 years, or even now, how can we learn, both policy scholars and policymakers, to take these critical steps back in the moments that they actually need this in order to run this world? Thank you.
Okay, thanks. And I'll turn it back to the panelists to address Anna's question.
If I may, can I start? Is that okay? No, I mean, thanks. That's a really fascinating question, and I think really, very, to the point actually, that I think one of the issues that we've seen, and it speaks a lot to Olivier's presentation, is the lack of understanding of policymakers of complexity, which Olivier raised, but also behaviour. So actually, that it's been fascinating that ideology and kind of expectations of policymakers has often overridden how we understand human behaviour. And actually, in the UK context, the failure to have some sort of rational expectations model of how citizens respond where they're not confident in government has been a kind of critical failure, that actually we see at the moment that government's pushing, for office workers to go back to the office, for citizens to resume social economic life without an implicit understanding that citizens can take rational decisions about their own safety. And I think one area where maybe this crisis is a little different from past pandemics. I don't think we have a great amount of information about the information flows in previous pandemics, is that we have so much information now that you can track number of cases on a daily basis. You can zoom in to the town that you're going to, certainly in the UK, I think in many country contexts, and look at the number of people who have been vaccinated, the number of cases, and make kind of quite rational cases of saying, oh, I don't fancy going to that hotspot of COVID cases where cases are rising compared to where I am at the moment. I'll just stay here. And so I think your question is how do we teach policymakers to operate in that context? And I think part of it is about really emphasizing that the way to design good policy, but also the way to bring citizens with you, is to understand their fears and their motivations. So I think that's what you identify as a crucially important question, one that I don't think policymakers have learned from. I just was seeing this morning in the UK, we're having exactly the same policy debate on reopening that we were having last summer, without learning any of the same debate, which was that citizens can make active decisions to protect themselves. Some citizens can, not all citizens, crucially, and that can actually hamper policymakers' intentions.
A quick answer also. What I mentioned very briefly before, and this is something which we insist upon a lot nowadays, when I'm presenting our work is the fact that behind the question of trust, which is a key issue, of course, there is a question of cooperation. Organizations, individuals that cooperate, that work together, that are interdependent, tend to trust each other much more than people who are independent from each other, organizations that are independent from each other. And I think, what we show is that the organizations that managed the best during the crisis were those that were able to create the conditions for cooperation. And this is one of the major lessons which should be drawn from the crisis, but which is currently not being drawn because there is, as I said, too much an emphasis on what didn't work. But when looking at how organizations manage, actually, it's key to understand how cooperation was possible during these times of crisis. For us, the key, and it's true for crisis as it is for normal policy making, it is understanding the conditions for cooperation. It is creating more interdependencies between organizations and actors in order for them to be able to work together, to find solutions together. And this is what policymaking should be about, much more than just deciding top-down decisions and then expecting some form of implementation. And as I said before, the fact that many organizations, many governments, but also private firms have tended to multiply organizations sous-traiter. How do you say sous-traiter in English? Delegate to the tasks to various other firms, have created a very complex set of institutions which is very hard to coordinate in a period of crisis, particularly when they don't know each other and where they don't have the minimum knowledge which allows for cooperation and trust. So I think the question is really, how do we build trust and cooperation as the two main tools in policy making for our students?
Thank you very much. So I think now I'm going to read the question that we have on the chat from Mayra Jurua, and my apologies if I pronounce it really, really poorly. So Mayra would like to know if you give some considerations concerning the impact of the level of industrialization and national innovation system on the government capacity to deal with the COVID crisis. So whether you feel that there are like some broad factors that may have also an impact on the capacity of governments to address the crisis.
Do you want to?
I think Jay, if you want to start.
Yeah, sure. Yeah. Well, COVID-19 offers both challenges and opportunities. And of course, there are a lot of countries got economic and social damages as we go through COVID-19. And then after 1 year and then 1.5 year experiences, and then many countries actually turn this around for making opportunities. And some of the countries, in fact, Korea is one of them, really design new kinds of new deals. They have, for example, digital new deals and green new deals and human new deals, so that they use COVID-19 as a way to transform the nature and quality of the economy, so that to some extent, in addition to all the troubles that we have, of course, and then there is big impetus and energy focusing on changing the nature of the economy. And I think there are a lot of innovation related financial resources actually focus on that direction. So I think that's we have two sides.
Thank you very much. I was wondering whether maybe Mireille would like to add something.
It's a little bit difficult because it's a different context. The African context is different. Whereas Yaounde is talking about socioeconomic damages. In the African context, we have, first of all, even before the crisis, we already have an economy economic underdeveloped situation, which make the crisis more difficult. But in terms of innovation may come from the support brought by international donors, different donors, who by giving impose certain conditions and modalities. By imposing modalities and by a kind of way of evaluating and following up the process, the push state towards innovation. In the Cameroonian context, it has been beautiful because even in the Ghanaian context and South African context, there have been many health buildings, new buildings, just concentrated on COVID treatment. So it's from that perspective that I can answer to that question. I said the crisis brings changes, and the changes in this context is very interesting because it pushes African underdeveloped economies towards innovation, toward performance structures. But on the other side, it also creates new economic, new marketization that creates new policy issues. I don't know if from that perspective you understand. It's okay. So
thank you.
International aid, international support, international donors create impose innovation because they follow up their gifts, if I can call it like that. There is obligation for results, to bring out results. That automatically push the state toward innovation.
Thank you very much, Mireille. Do we have more questions in the room?
Do we have any questions from the audience? I don't see any, Isabelle.
All right, so I do have my own question. If there is.
Sorry, Isabelle, Philippe has a question.
Okay, awesome. Go ahead.
I try to push people in the room to give questions. So I would like to know if, in your point of view, the COVID crisis have changed the complex relationship between academic, expert, bureaucrat, and politician. In one sense, the dependence to the academic and scientific have certainly increased, and in another sense, all the controversy and the uncertainty have probably break this link or complexify this link. So I would like to be interested in the different countries. If you think that there is an impact on the COVID crisis, on the policy making itself, on the relationship between all these categories.
Maybe we start with Paola, if you want, because we haven't heard you yet.
Yes, of course, I think that we have exploited a change. The experts have been listened, in particular people, experts in terms of health, epidemiologists, and, people experts of health, but also of policy. So I think this is also a change that we would like to explore better. But in terms of policy making, I think we still have to see what will happen. I mean, we have seen a lot of experts around saying, suggesting, being involved in plans for recovery, etc. But it's still not clear to me what is going to be their final impact with respect to the politicians. So I think this is going to be a very, very interesting right now. I mean, in this period where we are a little bit trying to recovering from the pandemic, and the policies have been done and or at least proposed. So I think this is something that we have to that we can study more from now on, because the immediate impact, all epidemiologists and all the scientific experts of health talking and telling us about the risks of the pandemic, etc. This is clear, but what will happen now, and what is the role of experts with respect to politicians or policy making? We are going to see it in the next months.
Thank you. Another of our speakers who would like to address the question.
I'll say a few words. I mean, I think in the UK context, one of the consequences of Brexit was this sort of the discourse that we'd had enough of experts and policy making was all about values. And I think certainly the pandemic has seen a sort of resurgence of the role of the expert in government policy making, and across all the countries run focus groups in, there was often a sense that citizens like briefings by experts. That actually was one of the things they would talk about. I mean, the level of engagement of citizens with those sorts of briefings by experts was something they liked. But I think it's also very easy to be complacent about the death of populism, that some way the pandemic has killed off these sort of anti-expert, anti-intellectual tendencies in different countries. And so I think one thing that we should be cautious of is that there's still elements of expert advice that have been, certainly in the UK, that have been criticised and that led us to, kind of have misunderstanding of the early stages of the pandemic. And I think the post-pandemic inquiries are going to be quite interesting in sort of unrolling some of that putting of expert advice on a pedestal. And so I think while in the short term it feels like experts have saved the day, that the kind of role of scientists in developing vaccines, understanding, the kind of testing and so forth has been very important. I think as the inquiries go on, it will be interesting to see how citizens then update those sorts of understandings and beliefs about the role of experts. And it may not be sort of initial positive picture that we have still at the moment.
I just want to make a quick comment. Can I? Oh, okay. Well, policy versus science, politics versus real data, and that's ongoing a debate. And I think it's a matter of politicization. Of course, there's different degrees of politicization of COVID-19 policymaking processes among different countries. And I think there's a sort of cycle. It's difficult to generalize it. And from my observation as a co-chairing National Infectious Disease Study Group, part of the National Research Council in Korea, and there's sort of, because not really many people know about COVID-19, and then science people and academic people really offer some their own expertise, and then policymakers take it, and then next round politicians, and then they sort of over science, and then later a lot of issues going on and problems again, and then they refer to science again. So I think there are different sort of cycles. At the same time, I also want to point out science is not one group. And when I had the research group, and even medical doctors, they did have very far different opinions on wearing masks initially. So we had a big debate initially. So that's, academicians, there are different groups. So it's not one group. And that's part of, politics among academicians as well.
Thank you. I think we have a question in the chat from Sabrina, who is asking, what about the role of parliaments in policy making during the crisis? Have been they able to mediate between governments and citizens on policy options, if not in the first phase of the emergency, more in the subsequent phases? So it's really the question about what can we say about the parliament? It is true that we haven't talked that much about the parliament yet. Is it the parliament as weak as usual, as strong as ever, or something in between? I think Olivier would like to speak first.
Yeah, very quickly. I think in the French case, it's clear that the parliament played a very minor role, not only during the first phase, but even the subsequent phases. I mean, they tried to retain some influence through reports evaluating the handling of the crisis, but clearly the parliament was set aside. And I think this raises two important questions in the French case, but maybe elsewhere also. First, the fact that in France, we had invested a lot in recent years in what we called health democracy. So institutions are promoting the participation of patient associations of multiple actors in decisions related to health. This came after the AIDS pandemic. And what's interesting is the fact that none of this was activated during the COVID-19 crisis. So we did not rely on any of the forms of health democracy, any of the institutions or instruments that had been devised in that sense, which is an interesting. I mean, why is I think an important question. And the second question also, which this raises, I mean, the fact that Parliament played a minor role, is how much civil liberties become an adjustment variable in decision making related to the COVID-19. I mean, as I think one of the questions also, I think it was in the Q&R, lockdowns are not public health decisions. It's not a public health measure. It's a measure of order, public order, of maintaining order. And what we see in the French case is that we have been successively managing, having states of emergency, one after the other, terrorism, now pandemic. And in this permanent, quasi-permanent state of emergency, Parliament agrees to play a very minor role, which is very worrying because this leaves all the power within the hands of the government, which has there's no checks and balances anymore in the French system for the moment in the handling of the crisis. And once the crisis is over, the emergency laws are turned into normal laws, are normalized. And so there is this sort of constant acceptance of the fact that when in a crisis, civil liberties are the adjustment variable. And I think this is quite worrying.
Thank you. I think, who would like to say something more? So maybe I ask you a last question and to all of you, and if you can just answer quite shortly, and then we will have to conclude this session. So what about evaluation? So you all have pointed out question of trust, question of performance, and now my question is about evaluation. Once the crisis is settled, maybe we will still be living with COVID, but once massive amount of crisis is settled, what do you think is going to happen in terms of evaluation of policy actions? Because we can see that we have a lot of things going on. In the UK, there is already a lot of people talking about inquiry following a number of decisions. So what is your insight about the aftermath, in terms of policy evaluation? Are we going to learn from what we did during the crisis, or we can just gonna move next to the next crisis? Maybe we start with Mireille, because we haven't heard her yet for a long time.
Very, very difficult to talk about evaluation in a particular context where citizens are always there to judge the governmental actions. In particular context of crisis, there is a lot of doubt about the institutional capacity, what the government is able to do. And we also in a situation where when there is a crisis, most of the eyes are turned towards the outside world. Where is the solution will come from, etc., etc. There's also a context where when there is a crisis, the crisis arises, international actors, which as historical partner of the state, which as an international organization financing the state, financing most of the project, are attentive to what the state is going to do. So in that situation, evaluation is very, very complex. It's what I can say. If I can ask, we will be in a context of rational evaluation, scientific evaluation, it's subjective emotions, rational oriented evaluation, etc. So I think it's a very complex issue where different actors attempt to influence the policymaking process in terms of judgment. In context where judgment occurs because there is a lot of doubt about the institutional capacity, and there is also institutions that attempt to resist to what is they ask them to do. I'll stop there and leave the discussion forward for future.
Thank you. Paola, maybe you would like to tell us what you thought about really the gender impact of COVID, the crisis,
yes,
the policy decisions that were made.
Yes, I think the evaluation thing is really crucial and very, very important. We know in terms of the impact of COVID on gender equality, this has been already done, but it's going to be done. For example, what we certainly have learned is from the crisis is that all reforms. I'm talking about Italy, for example, which we receive a lot of this, Next Generation EU resources, but one principle which has been introduced for the first time in this recovery plan is, for example, that we need to do a gender perspective evaluation. So an impact evaluation by gender of all reforms and all plans that we are going to implement, which basically means both ex ante and then ex post. But even ex ante, before introducing a reform or a policy, we need to understand what's going to be the impact on gender differences, on women's work, and so far and so on. So this is something that we learned also from the pandemic. I mean, it got an acceleration because before nobody talked about this type of gender impact evaluation. So I think this is going to remain, and somehow it's a positive thing. So it's something difficult to be done because of course it's not easy. So we need of course also experts in addition to politicians and people working at the policy level. But it's one of the lessons that is going to remain also after the COVID, because we have seen a lot of impact, especially on women, on women's work, on the loss of jobs by women, etc. So this idea of introducing an impact evaluation by gender on all reforms. So in terms of transversal, everything that we are going to, every money that we are going to invest for the recovery has to be evaluated in terms of the gender impact. This is a lesson that I think it's going to be important and will remain also after the pandemic.
Thank you very much, Paola. We are just running a bit over time, so I will pass the floor to Jay and ask that you really keep your answer quite short, even if I'm sure you would like to chat about all this for hours. At least I would like to. So Jay?
Well, policy learning is very critical, but I don't think there's a perfect learning. And I had a chance to read through 1,000 pages white paper out of MERS experience in Korea, 2015. Korea was the only second to Saudi Arabia, more casualties in Korea. And in fact, there are a lot of policy recommendations in the white paper, and probably half of them actually introduced and implemented, and then the other half actually not implemented because of politics and the resource allocation issues. Well, let me just conclude my comment. Well, in fact, 2015, the one who got penalty because of mishandling or poor handling of the MERS was the one who really led Korean CDC. Because of the tacit policy knowledge and her experiences really became the foundation for the, relatively speaking, effective mitigation of COVID-19. So it's not perfect, but I think there is learning.
Thank you very much. Olivier?
Very quickly, so I addressed partly the question in my presentation. In France, there is clearly no sign that there will be a major exercise in drawing lessons from the crisis, which is a pity, which is sad. But as I said, there are accountability issues. There are already many trial court cases against ministers and the government and high civil servants. There's also issues of maintaining existing arrangements. So I'm quite pessimistic on this side. As students of policymaking, when in organizations also, I think there's something interesting in this crisis which we've not seen before, and which probably we should reflect upon, is the fact that many, in France at least, many non-state organizations, local governments, NGOs, professional groups, have undertaken what we call in French retour d'expérience, so heart washes, so these exercises where you try to draw lessons close after the event. And actually, this material is quite unique. And I don't think there have been many crises in the past where we had so much production by organizations of what lessons they draw from this crisis. And this is, I think, an interesting material. We're going to be working on this. We're trying to collect it and analyze it. Of course, it's very dispersed, very different, very, very. But in terms of producing knowledge, as we say in French, à chaud during the crisis, I think there's some really interesting data there that we should work with and try to analyze alongside other data that we can collect with our usual methods. I think there's a unique set of data which we need to work on.
Thank you very much. And I will give you the last words.
Thank you. I'll be very brief. I think for me, the key question you'd start with, without wanting to be too pessimistic as well, we haven't learned from past crises. So or why certain countries and institutions haven't go past crises. So I think that Jay's comments around the Asian experience of MERS and SARS is very interesting in the sense that I have to say I'm not convinced that of some countries, including the UK, if we were to hit by another pandemic, we would have the same sort of cultural foundations of wanting to wear masks, adherence to particular sorts of controls. And so while it's easy to say, oh, we're going to learn this time from this big crisis, I think we should be very skeptical about that. And I think this is one of the areas which is not a new theme. I mean, Olivier brought up the work of Lee Clark, that sort of work on coping with disaster, how we have these fantasy documents that we think we're going to respond to crisis in a particular way is so crucial. I think all we can do is push that. And I think, that persistence of cultural factors is really important. I think the final thing I would say is that essentially, I think what's really interesting is and that question of actually how society adapts to the future risks of pandemics rather than states. So it seems like in the UK, actually, certainly in the university sector, organizations have felt abandoned and they're starting to take measures into their own hands, right? And so the sorts of organizational discussions that people will be having about working from home and so forth will start to be outside the area of the state. And so while those of us who study public policy will inevitably focus on the official decision-making structures, international organizations and so forth, we should also reflect that actually citizens and private organizations or semi-private organizations are going to have long-term legacies that we should be reflecting on, but actually may not be the same as how policymakers respond when they're thinking in much shorter electoral windows.
Thank you very much. I think I'm not going to keep all of you any much longer. I just wanted to give you a big thank you to Mireille, Paola, Jay, Olivier, and Will for their fantastic presentations and the really interesting discussion. I wish to everybody in Barcelona a great sunny day. To people living in England, well, good luck with the weather. And to the rest of Europe, I hope that thing is really well. Have a nice afternoon. Thank you very much. See you next ICPP.
Really?
Thank you. Bye-bye.
Thank you.
Thank you.